Hello, hello. In the interest of time, I'm going to go ahead and get started. And before I get started, I just wanted to make you all aware that in order to get CME credit, you're going to have to sign your name on this form. So we're just going to pass it around and realizing maybe other folks might come in. So just making sure that they sign it. Thank you. I'm sorry, I don't have a pen, so you will have to procure your own pen. Oh, great, thank you. All right, so without further ado, good afternoon, everyone, and welcome to AI Confidence Clinic. My name is Fatema Shipchandler Jafferji. I'm a third-year family medicine resident at Swedish First Hill in Seattle. I'm originally from Houston. Shout out to my Houston people. My sisters, Ruqayya and Zainab, were heavily involved in the development of this presentation. Unfortunately, they couldn't be here. But our goal with AI Confidence Clinic is to nurture you all, empower you all to feel confident leveraging AI to work smarter and live better. And we kind of have different ways of showing this. So first off, I just wanted to introduce us. Zainab, Ruqayya, and Fatema, we comprise of ZRF Group. We have a consultancy at the intersection of our varied backgrounds. So my sister Zainab bin has a public health background, Ruqayya bin has an AI background, and I'm the clinical component to the group. So together we develop health and AI literacy content for caregivers, care providers, and just broadly the community. So we have an array of services that we're working to build up and offer to the community. So if you're interested in chatting more, I'd love to talk. And then just to go through our disclosures, all three of us are employees of ZRF Group. My sister Zainab bin is a shareholder. Ruqayya, many of you may know Ruqayya bin's Amida AI. She's the person behind that, so she's a shareholder there. I'm an employee of Swedish Providence, and we have no other relevant financial relationships to discuss, we're not sponsored, nor do we endorse any of the AI tools discussed today. And then some of my personal disclosures, just to set the stage. I'm not an AI expert. I'm simply a non-technical physician person curious about AI and kind of how it's going to impact our lives and our futures. So my goal today is that we all learn from each other and learn together. And if any AI questions come up that are out of my scope or understanding, I'm happy to connect you with my sister Ruqayya, who knows a lot more. In fact, most of what I know is from her. The next piece is, please be familiar with your organization's policies around AI use. What we discussed today may not be allowed where you work, and of course we're also thinking about patient safety as well, so be mindful of that. And finally, always use your best judgment. Sometimes it's not the right opportunity or situation to use AI, and hopefully through this presentation you'll become more confident in identifying use cases where it is or isn't appropriate. So, like with any clinic appointment, we got to start by agenda setting. So, and also like with any clinic appointment, we've got to start with a temperature check. So we're going to use Mentee to kind of gauge how folks are feeling about AI. Next, we're going to talk about just AI basics, get a foundational understanding of what AI is and specifically what chatbots are. Then we're going to delve into my two favorite AI tools at the moment, Open Evidence, hopefully to help us work better or work smarter, especially as clinical folk. And then ChatGPT, which many of you may have familiarity with, leveraging that to both work and live better. Next, we're going to pair up and practice some prompting on ChatGPT. And then finally, we're going to share what we've learned with one another and hopefully develop a prompt pack that we can all take away from today and utilize in our day-to-day and continue applying to our day-to-day life. So let's start off with Mentee. Go ahead and grab your phones or devices. You're welcome to scan this QR code, or you can log in via the link if the QR code isn't coming through for you. So I'll let you all do that. All right, if I see some nods, I'll know we're ready. Some nods, okay, cool. All right, so I'm gonna pull it up on the other, right here as well. All right, so here is our Mentee, second chance for folks to get that QR code scanned. All right. Then the code will remain up top in case you need to still join, but we're gonna move forward. So just wanted to put out this consent notice. Data will be anonymized from the answers to the mentee, and then ideally used to publish a report on AI literacy and empowerment. So if you do not wish to be part of that, the report, then no need to proceed. Just follow along with our session here. So first off, what are the first 3 words or phrases that you think of when you hear artificial intelligence?
Air India.
What was that?
Air India.
Air India, interesting. Yes, AI. Indeed. Gonna take over the world. Interesting. Okay. New world power. Are you guys okay? ChatGPT, robots, computers, NVIDIA. Okay. Do it for me. Cool. Interesting thought. I'm interested to unpack that more during the session. Terminator. Resourceful. Smart. Job loss. Okay, interesting. We'll unpack that one as well. Meta-analyses. Okay, we got some researchers in the group. Help. Help is coming up a bunch. Efficiency. Great. Streamlined. I like that one. A wife who listens. Intriguing. We'll have to talk later. Delegation. Okay, a lot of these are things that we're going to discuss further today. So I love that you guys are already, exploring AI kind of mentally, and I'm sure many people have many thoughts about it. This certainly spans the full array of how people must be feeling. So let's, oh wow, folks have already filled this out. But what is the #1 work or life task you wish to delegate or had more time for? This will also kind of inform the rest of our session, specifically the end part. Chores, professional work, email responses, time with wife and kids, love. Okay, cooking, lots of cooking, learning, scheduling, physical activity, note writing, cleaning. Oh, if only. Driving, okay, yes. Answering email, studying, Hussein. Okay. Kidmut, awesome. Okay, charting. I'm seeing a lot of kind of administrative tasks, home tasks, and I'm glad that we're thinking along the same lines. All right, so let's go back to our presentation. Ooh, if I can find it. So let's unpack this a little more. I know there was kind of the full gamut, the full array of feelings that people have about AI. I think they're all valid, and I think some of it may be informed by these fear-mongering headlines we're seeing in the news nowadays about AI being better at diagnosing conditions than doctors, or Bill Gates saying that AI is going to take over jobs of physicians and teachers. It's natural to feel discouraged and even a little offended, especially all the years that we take developing our skill set and establishing relationships with our patients. But once you learn more about AI and you lean into it, you're better able to see through the hype. Once you better understand how you can leverage it to make your life better, you have more capacity to engage with your patients, because ultimately AI has something that we don't, and that's our patients and clients' trust. And so, and I think maybe when patients are trusting AI too much, that's a different story that we'll also unpack. But one of our close friends and colleagues, Dr. Fatema Shipchandler, Dr. Fatema Dollar, who is a pulmonary critical care physician. She couldn't have said it better. She says, "I don't see AI as a threat, I see it as a tool. And like any tool, it's how we use it that matters. Used wisely, it has the potential to free us from routine tasks so we can focus more on what only humans can do. Care deeply, think critically, and be fully present for the people who need us the most." And so with that, the goal for today is to turn our curiosity and maybe concern into confidence about this technology that inevitably we're going to be facing in the future and also now. So let's jump right into better understanding AI, the enigma. So what is artificial intelligence? AI refers to the field of building, using, and studying computer systems that are designed to perform tasks that are typically conducted by human intelligence. And so there are two main categories of this. There's predictive AI, and that's AI that understands patterns and anticipates outcomes. So within that, there are kind of three types of predictive AI we're going to be talking about today. Rule-based AI, this is AI that has explicit instructions. So this may be, triggering some people here. This is a drug interaction warning that many of us prescribers may be seeing when we try to prescribe a medication, but it's a necessary safety net. This is a form of rule-based AI where drug interaction, databases, patient's allergy list, or maybe their pregnancy or lactation status may prompt us to prescribe differently. Next is machine learning. This is a form of predictive AI that actually doesn't need instruction. It detects patterns, and sometimes some may say it kind of goes rogue, but there's kind of nuances in how it can provide structured output. And so one form of this is a tool, AI tool that can assist radiologists in identifying precancerous or early cancer, lesions much sooner, much earlier than was previously possible without the use of AI. And so this is especially important now that we are, screening people earlier with the new guidelines. And then finally, reinforcement learning. This is a form of predictive AI where general patterns and trends are inform an output. And so as far as, here we see a continuous glucose monitor. This is one of the most breakthrough forms of reinforcement learning as far as diabetes management. Folks who have a CGM and insulin pump can have their CGM track their daily sugar trends and then have that inform their insulin titration. Can be titrated almost moment to moment. So, as far as diabetes management, this is groundbreaking. Processes that would take months and months are now happening almost instantaneously. So now let's move on to generative AI. This is the form of AI that has a lot of hype right now, and that we're going to be unpacking and kind of exploring further today. This is the form of AI that can create content that includes text, images, audio, and video. And we're seeing this more and more in the healthcare spaces, right? So clinical documentation. Who here has used an AI scribe? Okay, some hands in the audience. Awesome. And the AI scribe is kind of all the new rage, especially for us primary care folk who have lots of volume of patients, so little time for documentation. This really helps with that administrative burden. Next is drafting content or communications, clarifying emails, writing prior auth letters, tailoring patient literacy materials. This could be a huge help. Next is literature review and synthesis, of course, with the huge amount of research that's now being developed and published, especially with now the AI being incorporated in a lot of the development and publication of research, it's near impossible to feel like you're actually staying up to date and evidence-based in your practice. And so AI can really help hone in on providing tailored recommendations for specific clinical scenarios or answering clinical questions in the most evidence-based way. And finally, here we see an image of Dr. Anthony Fauci hugging Trump. This is a deep fake. I think, obviously it says the word fake, and I think most of us would realize this is probably not real. But children or people who don't know better may see this and be convinced about it. And AI can create very convincing images, and that can also be translated into videos. Who's seen the Obama video saying a bunch of nonsense? Yeah, okay, one person. Thank you, I think that's good. But essentially, I think the key here is AI can be very convincing and very dangerous. And that's something that we as, physicians and healthcare providers need to be so in tune with, because our patients are seeing lots of AI-generated content, articles that can be complete and utter rubbish. So it's important that we are mindful of these things. So now that we have a sense of kind of what AI is, let's recognize kind of how we can maximize the benefits of AI. AI can reduce the tedium that we have as part of our administrative burden. It can help streamline our communication, make sure that our emails and patient education materials have the right tone and are catered to the right audience. We can make our research more efficient and make sure we're providing as tailored evidence-based care to our patients as possible. And then finally, we can amplify our value. Once we offload some of that administrative burden and tedium, we have so much more capacity. We get so much more return on investment as far as the energy that we're putting into our patient care. But simultaneously, we can be more present for ourselves, for our families, and more broadly for our community. And simultaneously, we have to talk about the pitfalls of AI and how we can try to minimize them. So one of the key pitfalls that is not talked about enough are the privacy violations that AI is capable of, especially in the various tools and the user agreements that we mindlessly scroll through and sign. There are little nuances in the text that AI-based companies are very insidious about, using your data, which is ultimately profit for them, to teach their models without really clear consent or easy to understand consent. And simultaneously, when it comes to patient care, patient privacy, and HIPAA violations, we're very susceptible to that, with AI just being so easy to use but hard to use safely. Next are hallucinations and generating misinformation. Who here is aware of about what hallucinations are in the context of AI? Okay, great. I see there is already some baseline literacy here, but hallucinations, which we'll talk about a little bit more in a second, is essentially when AI is very confidently wrong, and this can be, this is like rampant in AI outputs if you sit and fact check exactly what AI is saying. So very important to be mindful of that, especially in the context of the deepfakes that we saw. AI is riddled with lack of regulation and oversight. Right now, regulatory bodies are scrambling to make sense of this like wild, wild west situation where AI, startups are developing these tools and implementing them, and especially in healthcare settings, and with such little training and oversight, safety and privacy are really being compromised, and that's something we need to be mindful of as end users of these products. And then finally, biases and exacerbating inequities. AI is built on data, historical data, and if that data is steeped in historical inequities, like racial inequity, socioeconomic inequity, the outputs of our AI tools can reflect that and possibly amplify it. Similarly, some of those AI tools are built on data that's not representative of the populations that we serve. Or it could be outdated. It could be, using data from, when medical definitions were different. For instance, an AI tool that was trained on data from before 2021 may still be using race-based EGFR. So those are things that we need to think about when we're relying on AI to give us clinical guidance. And also, one thing that actually came up when I was presenting my poster, AI-based tools, obviously there are lots of benefits. Minorities and low-income folks actually have less access to those benefits because the clinics that serve those populations are minimally resourced. So AI tools integrating these into clinical settings is extremely expensive and resource intensive, especially doing it safely and accounting for patient privacy. So that's another thing to keep in mind. In my own residency clinic, 2 of our 3 clinics do have AI scribes, but our one clinic that doesn't is an FQHC, and unfortunately it's not available to them. So something we need to be really mindful of as well. So now that we've kind of got our foundational understanding of AI in general, let's talk about AI chatbots. So these are kind of the most popular way that folks nowadays are interacting with AI. And kind of show of hands, has anyone used an AI chatbot before? Who has? Many of us. Shout out some of the AI chatbots you've used. ChatGPT. What was that? Open Evidence, another favorite. Claude, great. Any others? There are Perplexity, there's Gemini, yes. What was that? Grok, yes, Grok. There are a bunch. There's, Gemini, I heard from someone. There's DeepSeek, thank you, that was the one I was thinking about. Lots of hype there, so I'm glad that many of you have some familiarity. But for those who don't, what are AI chatbots? What are they good for? My sisters and I, what we think they're good for is reducing our tedium. People use them in an infinite number of ways, but the goal here is to kind of hone in on how we can use AI chatbots, generative AI chatbots, like our ambitious but imperfect assistant. Right? This is our thinking buddy who doesn't necessarily get everything right. And so here we have some examples on how AI chatbots can be of use to us. It can help us brainstorm, give us ideas. It can help summarize complex information. It can draft certain communications for us. It can help us think through difficult decisions. It can also help us map out kind of the process of getting to a goal in even a time-bound way, depending on what you ask it. A major thing people get wrong is mixing up what search engines are and AI chatbots are, and sometimes using them interchangeably. So search engines, we probably are all familiar with this and have used them. Things like Google, Bing, and these are databases that pull up. They just prioritize discrete searches, so primary sources for information. So search engines in general find information. So we've placed a keyword, insulin is, and now we have several different organizations who provided their definitions of insulin, and it comes from a verifiable source. So we can see where this information comes from. On the other hand, AI chatbots process information. So in particular, ChatGPT, which we have here, is trained on data from pretty much the entire internet. So if we think about what exists on the internet, it's many of these sources here that are verifiable, but also things like MySpace, Facebook, Reddit, the Onion articles, all kinds of things are informing what ChatGPT puts out. And so here, every time you put insulin is, you're going to get a different response. And there's no way to know where it's pulling that information from because it's simply predicting a response based on what it's learned from. So kind of to circle back to what hallucinations are, now that you kind of understand the difference between chatbots and AI and search engines, you can see how AI chatbots can very confidently be wrong. And that inherently is what's called a hallucination. These are instances where AI models generate false or misleading information and even can create completely fake citations and sources while appearing very confident in their responses. So for that reason, it's so important that anytime we're reviewing an AI output, we always double check it, we consult human experts, or we search for verifiable information where we can fact check what we're looking at. So now let's talk about open evidence. Who all has used open evidence before? This changed the game for me. For those of us who are, patient-facing or performing medical care in any capacity, this chatbot is trained on evidence-based research and guidelines only. So like we talked about, ChatGPT is trained on pretty much the entire internet. This is like kind of a refined and isolated set of data that it's been trained on, and that's constantly being updated with new research that's coming up. As you see, Open Evidence has partnerships with JAMA, New England Journal of Medicine, and all the big governing bodies of kind of various medical specialties. All you need to register for this app is a national provider identification number, or NPI, and it's free to use for anyone who has that. There's an Apple, Android, and web app for it, so it's rather accessible. And it is actually HIPAA compliant, but you do have to scroll through an agreement, read it thoroughly, and of course, always make sure that this is allowed for use at the organization where you work. So this tool can be immensely helpful for developing differentials, performing workups, or identifying what workup to perform, considering various treatment options, and even generally, broadly, for research purposes, like developing literature reviews or making sure that your research question hasn't been answered before. The key here, though, is that open evidence is still very much prone to hallucinations. The benefit, though, is that its output is cited with verifiable resources that we know are verifiable because we know that this pool is only coming from a distinct set of research. But it's always important to still verify your outputs, especially if something seems off. So please use your clinical judgment when using open evidence. And so kind of when we talked about search engines versus chatbots, we can think of UpToDate as our search engine and Open Evidence as our AI chatbot. What distinguishes the two? What are circumstances that you would use UpToDate versus Open Evidence? So UpToDate, for those who don't know, is a kind of compilation of various articles written by subject matter experts using the most up-to-date information. And this has generally been the mainstay of what people have used to perform clinical care. But as we see here, well, let's take a step back. Say you have a patient in the hospital who has a new diagnosis of atrial fibrillation. You want to start them on apixaban, but you can't really remember the dosing criteria for the decreased dosing. For older folks, every time I think about this, I'm like, something to do with age, something to do with their body weight, something to do with their creatinine. So, traditionally, before I knew about Open Evidence, I would have to go to UpToDate, search apixaban, scroll down to dosing for older adult, and then look at atrial fibrillation, and read through all this mumbo jumbo. I mean, the first thing I just see is and bold. So I'm like, okay, this is going to be complicated. And then you have to parse out what dosing applies to your patient. If you're waking up in the middle of the night and having to triage this, there's so much room for error. But when you look at open evidence, you just type out, the clinical scenario. That takes maybe 5 seconds. This was a very straightforward question, so the answer maybe took 3 seconds, and boom, I have it right there. Not only does it give me the dosing that would apply to this patient, but it also gives me the explanation below, and you can't really see it, but you'll see it in a second. There's a list of sources that it's citing from. So you're getting a much quicker answer, and there's less room for human error, and that's kind of what the AI is facilitating in this case. So let's try open evidence, and I won't read the scenario, but I'll give you a minute to read the scenario. This is a real patient scenario that I had in clinic recently. So kind of the gist of it, middle-aged woman, history of seizures, tremors, night sweats, elevated heart rate and blood pressure, normal kidney function, but 2 years ago. And so just looking for some help and how to proceed with her management. So here is open evidence. This is what it looks like. As you can see, I've had lots of different questions and queries over the past several months. But here I'll paste it in. And this is probably more extensive than what you need, but the more extensive the prompt, the more time it will take, but also the better output you might get. So it might be worth kind of making sure that your prompt is strong. And this is kind of there's no there's no standard way of prompting open evidence. I'm sure that will come up soon. But this is how I do it, and it works quite well for me. So here you can see, and I've done this search a few times, every single time, the first diagnosis that comes up is essential tremor. As many of us know, this is a diagnosis of exclusion. So someone who doesn't really have much clinical background or training may read this and be like, cool, this is essential tremor. If you continue reading down this list, a lot of these things were already coming up in my mind, but this was helpful to me as a thinking buddy to justify or kind of verify what I was thinking as well, while also simultaneously doing a verification of what it's saying. Thyroid, medication-induced, I'm thinking seizure history, maybe valproic acid, if this is some, primary neurologic issue. This is kind of my favorite piece, the most important not to miss diagnoses, especially in primary care, where we want to make sure to rule out the worst of the worst. Urine metanephrines for pheochromocytoma was not on my radar, but something I thought about. At least I thought about it, and then I could kind of get the key details from the history to make sure that, I'm ruling out the worst of the worst. Otherwise, hypoglycemia could be deadly, but so easy to rule out, right? So this kind of gives me a second brain to kind of help think through these kind of complex situations, and I'm sure we all experience them quite a bit. So now, going back to our presentation, now that we've kind of seen what open evidence has to offer, let's crank open ChatGPT. So I will have you all pull out your phones for those who would like to participate. And if you haven't already signed up for ChatGPT, I would encourage you to do so just to explore, but no pressure. So you could go to chatgpt.com, or you could go to you can go to your app store and download OpenAI, and then go ahead and sign up using your email or Google credentials. And so kind of the key thing here, as far as safety and privacy, which I would encourage you all to do, is turn off data sharing. This is the sneaky way that OpenAI uses pretty much anyone who has a ChatGPT account's information to then train other OpenAI models. And so the way to turn this off is going to ChatGPT, clicking your profile, and this may look different on the mobile settings, going to settings, then going to data controls, and look how sneaky they are. Improve the model for everyone. This is how they brand it. This is how they trick you. So make sure to click this and toggle this off. I already had it off, but here I am just showing you. And then include your audio recordings, include your video recordings. Imagine how those may be used to then create deepfakes and all kinds of funky things. This isn't to freak you out. This is just to let you know what is possible with AI and when data is available to anyone. All right, so now let's circle back and explore ChatGPT some more. All right, so as far as when to and when to not use ChatGPT, we've kind of broken it down to the 4 T's for either. So as far as when to use ChatGPT, tedious thinking is really what we would love to delegate to ChatGPT, mapping out ideas, refining concepts, and exploring creative solutions faster. Next is typing. Voice to text, if people aren't using that already, like DAX, Dragon Ambient Experience, people who dictate for their notes, that's like kind of, before generative AI, that is kind of one of the basic forms of AI that, many of us have already been using for a while. And then AI can also just help rephrase or speed up the writing process and improve our clarity. The next T is traversing. AI can help us navigate complex information and summarize research and help us to identify the information that we need more quickly. And then finally, AI can help with translating. Not only can it help translate different languages, but it can also reframe our ideas for different audiences. Say, for instance, you have a patient, a 7-year-old patient with type 1 diabetes, describing to them what insulin means can be kind of tough when you're working with adults in the family medicine world. So, kind of simplifying medical jargon AI has a place in that. Also very important to know when to not use ChatGPT. Thoughtful thinking, tasks that require critical human thinking should not be, AI should not be relied upon for this. Of course, in medical practice, when we're using tools like open evidence, we should definitely have some level of suspicion about what comes out and making sure that we can verify that, but that is, certainly ChatGPT is not the place to be getting research answers. Truth. AI, as we know, can confidently generate false information, so we should not rely on it for high-stakes situations or for high-stakes accuracy. Next is tally. AI is very bad at math, so if you have an accounting issue, turn to your human accountant and just avoid AI altogether. And finally, trust. AI chatbots are not inherently private. As you saw, these AI companies can be very sneaky in how they get your information, and it's kind of a black box as to how they use it. So really important that you're not placing in any private information or any information related to sensitive business data or legal or personal data, since there's no way to know exactly what happens to it. So these are our 3 primary AI collaboration zones, especially when we think about use of ChatGPT, Gemini, some of our basic AI chatbots. So home and family management, some of the ways we can use AI are meal, event, and travel planning, generating to-do lists, or calendar management. Next is work and personal productivity, strategic brainstorming, especially business ideas if you're trying to start from scratch, outlines and drafts, and then also just drafting communication like we've talked about. And then finally, we haven't really talked about this, but personal growth and well-being. There's so much opportunity for AI to help be kind of our counselor or provide us some structure in how we're trying to pursue our goals or even just enjoy life. So guided learning, fitness planning, or even tailored book and entertainment recommendations can all come from an AI chatbot. So as far as prompting, what are prompts? Prompts are giving instructions to an AI chatbot. And the better your prompt, the more useful your output. So we've kind of broken this down to the 4 C's of careful prompting. The first is context. You want to make sure to provide, tailored background about the ask that you have of the AI chatbot. Next is you want to make sure you're as clear as possible, clarity. State exactly what you need, including the specific format, the tone, specific to your audience. Next is concise. Chatbots can be very verbose, so unless you tell it, make sure that this is within 200 words or within a 200-word limit, or make it 5 sentences. It can probably go on, and you want to make sure it's reined in and as useful to you as possible. And then finally, critical eye. I have not said this enough during the presentation. I'll keep saying it. Making sure that you're checking for accuracy, fairness, and tone is so critical, and making sure that we're ethically and responsibly using AI tools, especially when keeping our audiences in mind. So here are some personal examples of how to use ChatGPT with some various prompts that I've come up with. As far as home and family management, I'll just read them out briefly, and we'll actually see what one says when I plug it in. For home and family management, you are a nutritionist. I'm telling ChatGPT, you are a nutritionist. Design a 5-day, low glycemic, high protein, low fat meal plan for a busy couple, including a grocery list that includes quantities and also accounts for the following dietary guidelines: no pork, no seafood, no alcohol. Next is my work and personal productivity prompt that I've actually used. You are my administrative assistant. Draft an email requesting time off from Ashara Mubaraka for a third-year medical resident and provide a proposed coverage schedule based on the attached resident calendars. My last personal growth and well-being prompt is, you are my tutor. Provide a 12-week revision schedule for the first 5 chapters of the Quran with a break every Sunday. Include strategies to help me remember which page comes after the other. And some of the hafizes in the audience can maybe give me some more tips on that. So I guess, does anyone have a favorite from these that they'd like to see the response to? Anyone?
Home and family management.
Yeah, sure. Especially we've had lots of talks on metabolic health and nutrition. I think that's apt. All right, so let's plug this into ChatGPT. In ChatGPT, I actually didn't turn on the privacy thing, and it knows me pretty well. So if anything compromising comes up, just warning you. There we go. So here is a simple, realistic 5-day, low-glycemic, high-protein, low-fat meal plan for a busy couple, 2 adults, with the various dietary restrictions. Here is day 1, yogurt parfait, 1 boiled egg each, grilled chicken breast bowls, turkey and veggie lettuce wraps, protein oatmeal, lentil soup. So clearly it doesn't know that we're desi. And so I think, so here, interestingly, ChatGPT knows a lot about mu'mineen, maybe a little too much. It is a bit unnerving, but you could add in, like, I am Dawoodi Bohra. Please include, sorry, I'm gonna put that over. I need voice to text. No gelatin. Well, that's I think incorporated in the no pork, right? Or I think I included that up here, or kind of in the prior prompt. So it remembers your prior prompts, right? Ground turkey keema. Okay, it did change that up. Lentil soup, Indian style. Masoor moong. Baked chicken tandoori style. Okay, this is not super specific to us, but I think it has recognized that we have some Indian background and has tried to incorporate that. It's attempted, but see, our assistant is imperfect and takes some chipping away and making sure that the output is something that aligns with what we would actually use, but at least it's created a framework and kind of a basis for us to jump off of. All right, so now let us give it a shot. Now that we kind of have the basics down, let's pair up and prompt. So go ahead and turn to the person next to you or kind of the people around you and choose a collaboration zone like we talked about and craft a prompt using the 4 C's, and then we're going to share it all together. Apologies, I've just put up the 4 C's and the AI collaboration zones for you all to review and refer to.